Well, the Omicron-fueled COVID surge continues to spread.
If you have COVID questions that you'd like to get answered, get ready to pick up the phone.
Dr. Zorba Paster will take your calls in just a minute, but he joins us now from his clinic in Oregon. Thanks for being with us today, Zorba.
Hi, Zorba. Good to see you.
Good to see you.
Let's talk about COVID and mental health and depression. I think 2 years in, people are just had enough.
Absolutely. I mean, it is a big issue, especially a big issue with teenagers and with young adults who are just developing. They're developing in terms of their friends, their relatives, their family. All of a sudden, COVID came in. They don't have their normal communication. And we've seen a huge spike, not only in mental illness, but also a spike in suicides. And I think the bottom line here is we have good treatments for mental health. It's a matter then of reaching out for that person. We have excellent antidepressants work. We have cognitive behavioral therapy, which is the only therapy that has really been shown scientifically to work. It's worthwhile. It's approachable. People can get it either online or directly there. But it's recognizing when you have depression that you need help and then trying to get that help, because healthcare providers and others are really the key source. But if you don't ask, you don't end up getting help.
Right. And it's reassuring to know there is so much help out there.
Absolutely.
The head of the FDA said today that it now appears likely that most people will eventually either be exposed or infected by Omicron. Is this just a reality that we have to grasp now moving forward?
I think we have to. Omicron is incredibly infectious compared to Delta and compared to the first COVID that actually came out. And what we've discovered is that Omicron appears to infect so many people that it's almost going to be hard not to be infected by Omicron. And of course, we know that you're 30 times more likely to end up in the hospital if you're not immunized. So we know immunization keeps it down. And I think we'll get to a point where we live in the future with Omicron, with COVID, just like we live with influenza. And once we get to that point, then society is going to completely reopen. But the Omicron variant is incredibly infectious. But luckily, most people do not get seriously ill. And the ones who don't get seriously ill are the ones who receive their jabs, their shots.
That's right.